Hi everyone, welcome back to Living a Balanced Life with Julio. On today's episode, we're going to talk about menopause, signs and symptoms of menopause, and how you can manage menopause to prevent complications that are associated with it. If you're interested, please stay with me.
Exclusive.
Menopause is a natural part of the aging process in women. It marks the end of a woman's reproductive ability. It is a period of hormonal changes, and you may experience symptoms such as hot flashes during this time. Menopause is not an illness. It is a natural process that all women experience as they age. Menopause may also be as a result of having a surgery to remove your ovaries. Natural menopause can begin anytime from age 40 to about 50. The process begins several years before your menstrual period stops completely and lasts for several years after your period has ended. What is premenopause? Premenopause refers to the stage between your regular menstrual period and your menopause years. During this time, you may experience some of the symptoms of menopause, such as hot flashes and night sweats. Many changes during the years leading up to menopause or the premenopause period are brought on by changes in level of hormone produced by the ovaries, mainly estrogen. As menopause is near, the ovaries make less of hormone called estrogen. When this decrease occurs, your menstrual cycle or your period starts to change. It can become irregular before it stops completely. Physical changes can also happen as your body adapts to a different level of hormones. Natural menopause is determined after you have been without your menstrual period for at least 12 months. And many of this is determined by having a blood test done, testing your estrogen level. The first sign that your menopause is approaching is when you start to have irregular periods. They may come more or less frequently than usual, and they may be heavier or lighter than usual. Premenstrual symptoms such as bloating, tiredness, irritability, and headaches may also worsen during the premenopause period. Almost 75% of women experience hot flashes during their menopause process. Hot flashes may occur for about 5 years or more. Hot flashes that disturbs your sleep at night is called night sweats. Some of the tips that can help you reduce your hot flashes include avoiding spicy food and hot drinks. Drink lots of water to keep yourself hydrated and to also have water while you're having the hot flash. It's important to limit your caffeine and alcohol intake. Try to reduce your stress level and participate in regular physical moderate activity to help you. If the symptoms of menopause are very uncomfortable and unbearable, you can speak to your healthcare provider so you can discuss hormone replacement therapy to help you manage the symptoms that are associated with menopause, like hot flash. Some women gain weight. Some women experience weight gain during this period as well. If you experience weight gain, you may be able to control it by following a well-balanced, low-fat, high-fiber diet and getting involved in moderate physical activity. So making sure that you're moving more and exercising, walking for at least 30 minutes a day, 5 days a week will be efficient to keep your weight down or to help you lose some weight if exercise is new to you. Aim for 150 minutes per week minimum of aerobics exercise, and making sure that you're including resistant type of exercises. So exercise that you're working with weights or against your body weight to help you build muscle mass, to help you maintain your weight, lose some weight, and help you with your bone health, because that also gets affected when you reach menopause. A decline in estrogen causes fat cells in the abdomen, which is your belly area, to store more fat. It may even reduce your ability to burn fat. So to help you lose weight during menopause, these are some of the tips. Make sure you're eating mindfully. Only eat when you're hungry. Watch your portion sizes. Make sure you're eating and including all the different food groups, from lean protein, plant protein. Make sure you eat a variety of food to get all the nutrients and vitamins that you need to prevent some of the symptoms associated with menopause. Making sure that you're eating high calcium, low fat, high fiber diet is a good way for you to get all the calcium that you need for your bone health and to help you maintain a healthy bone and healthy body weight. Eat and drink 2 or more servings of dairy products that is rich in calcium. Calcium is found in dairy product. Fish with its bones like Sardines and canned salmons, broccoli, legumes are all good sources of calcium. Make sure that you're getting your iron through iron-rich food, and you're having 2 servings at least of iron-rich food each day, and you get iron from poultry, fish, eggs, leafy greens, nuts, and rich grains and starches. The recommendation daily allowance for iron in older women is 8 milligrams per day. So if you're someone that's suffering from low iron and you're taking your iron supplement, continue to take it, but make sure you're also eating iron-rich food when you reach menopause. All these foods that are rich in iron are also high in fiber, because fiber can help you lower your cholesterol level, help you prevent some of the symptoms of menopause, and also help you stay healthy, prevent osteoporosis, and keep your bones strong. Sleep changes occurs during menopause. Sleep disturbance such as nighttime awakening and insomnia are common and may happen more often during the premenopause stage, or if your menopause was surgical. So if you had your ovaries removed, this will put you in menopause immediately. So after this surgery, you will immediately be in menopause. And with that comes the hormone changes, which can cause sleep disturbance. Menopause by itself can cause lower progesterone level, and progesterone is the sleep-induced hormone. So when that level goes down, it's hard for you to fall asleep. So some of the tips that can help you improve your sleep is to try to follow a regular bedtime routine, go to bed and get up at the same time every day. Even your bedroom cool and dark, relax before going to bed. Try to avoid caffeine and or alcohol close to bedtime, and try to de-stress, deep breathe, and meditate before you go to bed. Reduce screen time. These are all ways to improve your emotional health, improve your sleep, all symptoms that are associated with menopause. Hormones are the messengers in the body that stops, start, speed up, or slow down our physical and chemical functions. A woman's ovaries are the source of estrogen and progesterone, the 2 key hormones that control the reproductive system, including the menstrual cycle and fertility in women. During menopause, estrogen depletion can bring on combination of hormone and biochemical functions that can lead to changes in the brain and in the nervous system, which can affect your mood, your overall health, and your mental health. The low estrogen that's associated with menopause can affect a woman physically, mentally, and emotionally. So physical symptoms include fatigue, night sweats, insomnia, meaning you're not being able to sleep, hot flashes, memory loss, tension. These symptoms can cause emotional distress for a woman. Mood changes such as irritability, feeling of sadness, lack of motivation, aggressiveness, problem focusing, stress, difficulty concentration, depression, mixed with cognitive changes can all have an emotional impact and emotional distress on a woman that's going through menopause. Potential relapses or changes to pre-existing syndrome of mental illness could also happen. So if a woman has already a mental illness like anxiety, depression, or bipolar disorder, and they're going through menopause, this can make it, the menopause and the depletion of estrogen and progesterone can make their symptoms much worse. Some of the ways that you can improve your emotional wellness while you're going through menopause is to learn relaxation techniques such as yoga, deep breathing, and meditation. Participate in regular physical activities, because when you exercise, your body releases hormones that are called the feel-good hormones that can help you stabilize your mood, decrease stress, distress hormones. Avoid caffeine for some people, because caffeine can be overstimulated. They won't be able to sleep, which then can tie into the fatigue and making a person feel really bad. Participate in activities that you enjoy. So get involved in activities that makes you feel good about yourself. Enjoy a relationship that helps you to feel good and to feel good about yourself. Always speak to your healthcare provider about the way you're feeling, about your symptoms of mental stress and mental illness during menopause, so they can come up with a tailored management strategies for you. Due to the hormone depletion during menopause, a woman can experience symptoms of menopause, and it can affect their overall health. So some of the complications that menopause can bring on include osteoporosis, heart disease, relationship issues. The relationship issues usually during menopause is because of changes in sexual desires and other symptoms such as vaginal dryness, irritability, and mood swings. It is important to focus on your relationship and to find ways to keep openness and intimacy during menopause. Some of the vaginal symptoms may be relieved by avoiding soaps and using a water-based cream instead. Ask your doctor and other vaginal creams and lubricants that may be helpful. Your doctor can recommend local estrogen therapy that is delivered in the vagina by cream, tablet, or ring, which may relieve vaginal discomfort and some sexual symptoms. Estrogen is important for maintaining bone health. Because estrogen level drop during and after menopause process, and after your bone may become weaker and more likely to break, it is important for you to consider your bone health during menopause. Some of the ways you can improve your bone health during menopause is making sure that you're exercising regularly, making sure you're eating foods that are high in calcium, and making sure you're getting enough calcium throughout your life will help you build strong bones and keep your bones strong during menopause. If you are vitamin deficient, so taking vitamin D, calcium, and other vitamin supplement can help you maintain bone health. Speak to your healthcare provider so they can give you specific instructions on which vitamins to take to improve your bone health during menopause. Also, estrogen therapy can be helpful to some women. Speak to your healthcare provider about your risk of taking estrogen therapy that can help you improve your bone health and prevent osteoporosis during menopause. For more information about osteoporosis and how to improve your bone health, I have a video that I made about 2 weeks ago on osteoporosis, and it gives you more details about ways you can improve your health for both men and women to prevent osteoporosis. Take a look at that video to get more information. Heart disease is a major cause of death in women who have reached menopause. Estrogen plays an important role in maintaining heart health, and because estrogen level drops during menopause, it is important to reduce your risk during the menopause process and beyond. Menopause does not cause cardiovascular or heart disease. Heart disease risk increase for everyone as they age, but for women, symptoms can become more evident after the onset of menopause. This is why it's important for you to take care of your heart through regular exercise and good nutrition, and by eliminating unhealthy habits such as smoking, which can contribute to your early menopause, increase your risk of blood clot, and decrease the flexibility of your arteries, which can lead to atherosclerosis. So take care of yourself, take care of your heart during menopause so you can continue to live a healthy, balanced life. Now that you are aware of what menopause is, the symptoms that's associated with menopause, the risks of health issues that are associated with menopause, and how you can use lifestyle management to improve your health, let's talk about hormone replacement therapy, because that could be used by your doctor as a way of managing your menopause and its symptoms to improve your overall health. Hormone replacement therapy is a treatment that may be prescribed by your doctor to help you manage your menopause and its symptoms. The hormone used in hormone replacement therapy is estrogen and progesterone, the two hormones that decrease as you reach menopause. The type of hormone replacement therapy that are available include estrogen taken alone, so sometimes called the estrogen therapy, progesterone, it could be either synthetic or natural, or a combination of progesterone and estrogen combined. Hormone replacement therapy is available in several forms. You can take it in a pill form, in a patch form, cream or gel, implants, injection, or vaginal rings. It is important to speak to your healthcare provider so both of you can come up with a decision on which form will benefit you and be most effective for you to use. Some of the benefit of hormone replacement therapy is to improve hot flashes, night sweats, and vaginal dryness. Estrogen therapy may delay bone loss, but only while you are taking the estrogen and not after that time. Other non-hormone medication may be better for reducing the risk of osteoporosis. There is no evidence to show that hormone replacement therapy may prevent urinary problems, memory loss, Alzheimer's disease, wrinkles, and heart disease. So speak to your healthcare provider so you can come up with a plan that can help you, looking at your risk factors, your family history, and come up with a treatment that can benefit you. Some of the risk factors of taking hormone replacement therapy include the side effects. So the side effects may include headaches, migraines, breast tenderness, bloating, irritability, and vaginal bleeding. Women who should not take hormone replacement therapy are women with history of breast cancer or have breast cancer. Women with a history of liver disease, blood clots, and or heart disease should not take hormone replacement therapy. Always speak to your healthcare provider before you start any medication or any therapy to prevent complications and side effects that may be associated with it. So to conclude and recap, Menopause is a natural process a woman goes through. It's not an illness or disease. There are symptoms that are associated with it, and these symptoms can be managed by getting involved in healthy lifestyle, like healthy eating, exercising, speaking to your healthcare provider about all the different symptoms that are associated with menopause, like bone disease, heart disease, relationship issues, and take medications that is appropriate for you after discussing with your healthcare provider to see what is beneficial for you, looking at your risk factors, your family history, so you can make an informed choice to live a balanced life. Remember to always take care of yourself, exercise, eat healthy, include lots of vegetables and fruits into your diet, drink plenty of water to keep hydrated and to help you maintain a full, balanced life. Until next video, take care of yourself and stay safe.
Exclusive.